Hi, and welcome to the Child and Family Development Podcast. I'm Gretchen Hunter, a licensed psychologist, and with me here is a speech therapist who is going to help us understand feeding therapy. Ashley, tell us about who you are.
Hi, I'm Ashley Godwin. I'm a speech therapist at Child and Family Development, and today we're going to talk about feeding.
So this is part of a two-part series. The other one is with one of our colleagues, Caroline, related to occupational therapy in that lens. And so wanting to build on that because our therapists work hand in hand in a multidisciplinary approach. But feeding therapy through the speech language pathologist lens is more focused on oral motor and being able to provide intervention and guidance unique to their scope of practice. I find that many families are really surprised to learn that speech therapists do more than speech, and that they really play a very critical role in helping children learn to eat safely and efficiently. So, can you tell us what speech therapists do in feeding therapy?
Sure, you're right. So when parents hear speech therapists, they often think communication only, but really feeding and swallowing are a big part of what we do, and they're in our scope of practice. So when we look at feeding, we're looking at questions such as, can they chew efficiently? Can they manage different food textures? Are they swallowing safely? Are their oral motor skills supporting successful eating? Is mealtime stressful because eating is physically difficult? And like many feeding challenges involve just more than preferences or picky eating. Some children simply don't have the skills that they need yet.
And so, what should parents look out for to consider moving forward with guidance from a speech therapist? How would they know that their child might be having problems feeding?
Sure. So as a parent, if you're noticing your child is coughing a lot around meal times, if they're stuffing food in their mouth, so looking like little chipmunks, putting a lot of food in their cheeks, holding it there. So you have your mealtime is over and an hour later you're watching a movie in the den and they pull out a piece of food. Refusing to eat, becoming tired or fatigued during meal times, crying, tantruming, or not chewing food at all, or choking. These are all big indicators. Really, it's innate that a child should want to eat. So if you're noticing that your child is doing any of these, or it's a stressful environment around mealtime, that's usually a red flag to come in for an evaluation.
And then during an evaluation, how do you determine, why eating is difficult?
hmm So we use like a pediatric feeding disorder framework. We examine four areas. We examine medical, background history, nutritional, what are they eating, what are they not eating, their feeding skills or oral motor skills, as we've referred to, and the psychosocial aspect. As an SLP, my primary focus is often the feeding skill, but I can't ignore the other domains. For example, a child may have poor chewing skills because they avoided solid foods after painful reflux. So if you're looking only at oral motor skills, it just wouldn't tell you the whole story.
And how does research support specific interventions so that kids can learn these skills and make progress?
Sure. The strongest evidence supports approaches that include repeated exposures, structured food practice, parent coaching, gradual desensitization, and behavioral principles. The most effective programs typically combine multiple evidence-based strategies and focus on measurable outcomes. An evaluation with an extended case history where we'll discuss medical concerns, their feeding history. Those are all a big part of it. What I typically do in an evaluation is I will gather that information from the parents, and then I will sit down and actually watch the child eat, and do a formal oral motor examination. So that's kind of what happens during the evaluation. Different things we'll do in treatment. They often include strengthening exercises with oral motor tools. So you might use bite blocks for jaw strengthening or chewy tubes to work on strengthening those muscles. We'll do a lot of modeling. We will do oral motor exercises in front of the mirror together. And but really like a lot of parent coaching. I find that home practice is key to making progress. Just coming to therapy one time a week is not going to fix the problem. Uh,
So can you give us some examples of what a treatment plan could look like for an infant?
sure. So with an infant, a lot of times it's difficulty with bottle or breastfeeding. And so it will be a lot of positioning techniques that I'll work with a mother on, different ways to hold them, different strategies for holding the bottle. We'll also look at the nipples that are being used on the bottle, and we might have to try different types based on the mouth, the child's mouth, the way that they're latching to the nipple. Um, we might look into their formula and try different formulas, if especially if they're have like a sensitivity maybe to milk or an allergy. We might refer back to the pediatrician to look more into that. And then in some cases, we are referring for like a modified barium swallow study, especially if I'm noticing a lot of coughing during the swallow, or if I suspect potential aspiration. Um, Sometimes we're referring to a GI doctor for reflux. And so we're kind of with an infant almost ruling out different things to find the root cause.
So how is a SLP treatment approach different from a lactation specialist that are, part of kind of postpartum care?
Yeah, that's a really good question. Often we work hand in hand. So many of my evaluations will come in from a lactation consultant because they have just not responded to the interventions that they have provided. So we suspect it's a little bit more complex than just, hey, like, you just need to tilt their head this way a little bit more um, or something like that. So typically it's they're referring to me, but we do work hand in hand. They're, can be similar.
And what would a treatment plan look like for a toddler?
Sure. So we are often eating together. So I'm doing a lot of modeling, especially let's say the child has a with soft foods, maybe they're just mashing it with their tongue to their palate. I'm literally showing them how to move their tongue to the side to push that food over. Or maybe we're taking a lollipop, a dum dum lollipop, and moving it from side to side to work on those tongue movements. Um, I'm teaching them pacing strategies. So if the child is just stuffing and, not chewing adequately before swallowing, we're working on, okay, we need to take a break and finish chewing before we move on to the next food. And then we do start with toddlers using some of those oral motor tools that I talked about earlier, if they're able to tolerate it.
And what would you say to parents in terms of things that they can try at home?
Sure. So I'll often have parents come and observe the sessions. Maybe not every session, but parents play a key role when it comes to feeding and oral motor skills. So I tell parents to keep offering the foods without pressure. Many times children need multiple opportunities to learn about the food before eating it. So you don't just jump straight into taking a bite. It can often mean like looking at the food, touching it, seeing it how it feels in your hand before seeing how it feels in your mouth, smelling it, touching it to your lips, touching it to your tongue. There's multiple steps before we just get to eating, and every step matters.
I think that's so interesting as a psychologist. I mean, you're really tapping into the idea that kids might be afraid of the food. And so letting them have opportunities to be playful and get used to it can help them kind of calm down enough to eat. Is there a part of that you mentioned, kind of if a kid had been choking or maybe has had, painful reflux, that there's some learned fear to avoid foods that haven't worked for them?
Yes, definitely. And I think I tell parents a lot of times that snack time is a great time to work on these more difficult foods because at meals we really are focused on feeding the child and making sure that they're not hungry, but snack time can be more playful. And so that's a great time to kind of explore these sometimes more difficult foods and maybe change the atmosphere and that where they're eating. So if the table seems like a stressful environment, have snack outside on the picnic blanket. So yeah, really making food more playful and enjoyable so that it's not always just focused on the eating part. I think it's really important.
So, what's your take-home message for families? This is such good information.
Absolutely. If your child struggles with feeding, you're not failing as a parent. Meal times can be stressful, and feeding is a complex developmental skill. The goal is not forcing bites, but helping children become safe and confident, successful eaters over time.
Great. Thanks so much for joining us.
Absolutely. This was great.